Thank you very much for being with us here today as we announce Nova Scotia's 8th Collaborative Emergency Centre, which will serve the people of New Waterford and the surrounding areas. And I'd like to recognize and thank the Deputy Premier Corbett, Mr. Jim Merkley, Mr. LeBlanc, Dr. Lang and the staff, and of course the many families, children, and seniors who came out to join us today. It is the hard work that you have done in your community that allows Better Care Sooner to be a success. Nova Scotia families have told us that they want stability, that they want peace of mind when it comes to getting health care. In the past, emergency room closures and lengthy wait times were the norm in Nova Scotia. Families, children, and seniors had a hard time getting appointments to see a doctor and sometimes had to wait days and even weeks, whether it's a sick child or an aging parent or a personal illness. Many of us have experienced the long wait in an emergency room or at a doctor's office. Even today here at New Waterford Consolidated, I understand that the emergency department is closed for the day. It is frustrating, to say the very least. Just over 2 years ago, the NDP government launched the province's plan to help end that frustration. Better Care Sooner is improving emergency care in Nova Scotia by keeping emergency rooms open, reducing wait times, and providing better health care for Nova Scotians and their families. Collaborative emergency centres are an integral part of the Better Care Sooner initiative. CECs are about making the best use of the skills and expertise of doctors, nurse practitioners, paramedics, pharmacists, and other valued healthcare professionals. It's about reducing the number of closures in emergency departments like the one being experienced here today, and it's about providing better access to primary health care. As time passes and things change, the needs of communities change too. The province's healthcare system must evolve to meet these changes. The CEC model is a perfect example of that principle in practice. The CEC in New Waterford will be Nova Scotia's 8th Collaborative Emergency Centre. Families in communities such as Parsborough, Tatamagouche, Pugwash, Annapolis Royals all have positive stories about how this innovative healthcare model is working for them. The CEC will help improve healthcare delivery for people in New Waterford as well. Families can rest a little easier knowing that their loved ones will have consistent, stable access to emergency care in the evenings and better access to primary care during the day. Patients will get to see their family doctor before an urgent issue becomes a major healthcare crisis. Another benefit is that doctors now will have greater control over their work life, and the residents of the community will appreciate the stability. It's also worth noting that the CEC model is receiving praise right across Canada. This year, during the Council of the Federation, Minister Weeks of Saskatchewan said that they wanted to implement our CEC model in the rural area of their province. You can imagine how that made me feel, Saskatchewan being the pioneer of Medicare, where Tommy Douglas brought forward the first plan for universal health care, to see Saskatchewan coming to Nova Scotia to learn from us and to take home. Their Premier, Brad Wall, said it best. He said, "We want to learn from the CECs, and then we're going to steal the model." They're working on developing a model that will fit Saskatchewan, and now I hear that Prince Edward Island is also considering adopting the model as well. Healthcare innovation is happening in Nova Scotia, and we are becoming a leader for the rest of the country. I'd like to recognize Deputy Premier Corbett for his hard work in bringing about this new CEC in New Waterford. I know that he believes in improving healthcare, not just in this community, but in fact in the system right across the province, and he works every day on behalf of the people of Nova Scotia to do just that. I want to thank the staff at the hospital and the Cape Breton District Health Authority, the nurses, doctors, nurse practitioners, paramedics, dietitians, physiotherapists, and the other healthcare professionals who are embracing the new way to deliver healthcare. They know, better than most, that changes are needed to ensure that their patients get the best care possible. They have embraced the CEC model They are leaders in healthcare in Nova Scotia, and I want to recognize them for that. Together, the province and healthcare professionals are working hard to bring better care sooner to more Nova Scotia families. Thank you for taking the time to be with us here today, and have a happy holiday.
Its great potential.